Hi, my name is Pooja Reddy, and I'm a junior at Lafayette High School, and I've been working on a Naloxbox project. This past June, I've been working on a project targeted towards opioid prevention resources, and that includes a Naloxbox, which is a prevention resource that would be placed around in high-risk areas around the St. Louis area that would provide access to those in need to naloxone, which is a life-saving drug that can be used in overdose situations to help them with those life-saving seconds to receive the help they need through the drug's use. I started off by asking professors at local universities who deal with opioid addiction as well as opioid research, and they helped me map out and find zip codes in St. Louis County that were high risk. And from there, I went to work with Prevent+Ed, and they also provided me resources. And working with the St. Louis Public Health Department, we also gathered a list of high risk areas that needed these Nalox boxes, and together we found some locations that would best suit the Nalox box, like the first couple of steps, like the first 1 to 2 boxes, and then talking to those companies, and then moving forward, we're hoping to get from 3 to 10 boxes in those high risk zip codes that we identified. I think the most important thing is first breaking the stigma around opioid addiction, as well as having a resource which is so readily available for anyone to use. We often see defibrillator boxes, and it's just so common to us now. So the same to be said with Nalox boxes, seeing that addiction is a problem and that we have these resources available to society for them to use. Another big thing that we see as a positive impact of the Nalox box is the anonymity of having that resource in need of a opioid overdose, as well as having resources that can be used in those crucial seconds, whereas a first responder wouldn't be able to react in those first couple of minutes. You'd be able to go to an naloxone box and retrieve Narcan and give yourself those couple of minutes that are needed to act and potentially save a life. I have someone in my family who dealt with opioid addiction as well as substance use. And when I first found out about that, I was shocked because I never realized someone who was a healthcare professional could be impacted by such a disease, as it often goes unnoticed. And from there, I started doing research and did a research project about opioids, and give a presentation about that with my partner. And from there, I went to do more research specifically in St. Louis County, and then I was appalled to see that over 11,000 deaths were attributed to opioid overdoses. And from there, I was seeing what can I do as a teenager in living in this county to help impact, like, better that. And from there, I saw Nalox boxes, which were like a ready resource that could be easily implemented and be put into many different places, used by many people. Like, it's a very timely solution to an addiction that's been going on for many decades now. I would say the biggest impact is that this is the time for change. We are living in a society where we have the opportunity to make change every single day. And I think the first step with that is with the Nalox box. We see that addiction is a problem, so every single day, what can we do to better that? What are some steps that we can take to have a better future for the next generation, for future kids? How can we foster a society in which we see that addiction is real, addiction is a problem, and we need to face it head on and find solutions to help create an environment in which people understand that we are here to help and there are ways to have and lead a healthier life. And with that, the Nalox boxes would help break that stigma that we have so deeply ingrained in our culture, and to have a mindset that we see that there is a crisis going on and we have the power to change that, and that teenagers have a voice. Like, you can sit doing your homework every single day, you can be hanging out with your friends, but ultimately you are the future and you have a voice, and this is the time to use it. So I'd like to thank everyone here at Prevent Ed, specifically Landon, Kristen, Jamie, and everyone else that's been helping me put together the Luxbox project, as well as the other projects that we've been working on dealing with awareness and teen leadership. I'd also like to thank Brittany Nelson from the St. Louis Public Health Department, as well as Matthew Elias from WashU, one of the professors that I worked with and helping me in the beginning steps.